everything that I talk about is something that you're going to use today when you go home and tell your kids and your sisters and your parents. Yeast really needs to be driven out, especially your seniors. They're with dentures and partials, and we know we see those dentures every single day. That really needs to be addressed. So if they bring these patients in, and you really just be tender and trying to help them understand, they have support groups, but if we can be supportive of this community in any way at all, it's really, really important. It's a struggle.
Get ready for your unofficial dental hygiene podcast. These are the tales of two hygienists, one East Coast RDH and one West Coast hygienist. Listen as they tackle the profession of dental hygiene with humor and enthusiasm. Now, please join Machell Strange and Andrew Johnston as they tell you a tale of two hygienists.
Welcome back, everyone, to another episode of A Tale of Two Hygienists, episode number 206. My name is Andrew, and there's no Machell. And so without her, I'm going to go ahead and just jump right into a few housekeeping things, and we'll jump right into the episode. So first things first, we have this amazing giveaway, and we have a lucky winner. Lindsay Sherrill, you have won the great giveaway. A special thank you to all of our sponsors. We have them on the website, but you can go check them out. We have Armor Dental, Elementa, RDH Magazine, Florida Probe, GC America, Gum Chucks, Mouthwash, Tepe, and some others who really went out of their way to give us really cool gifts for this giveaway. We also have a newsletter. We've talked about it several episodes, but I would love everyone to go to our website, sign up for our newsletter. In there, you'll see all the cool things that are happening. We have a couple of trivia things going on, and just some of the things that Machell and I have been doing. We went to Greater New York, so we talked a little bit about that one in this most recent one. We talk about the things that we're consuming. It's a pretty fun little newsletter, so go to our website and go ahead and get that. So if you would all do me a favor and stick around after the interview, I want to read our latest iTunes review. It is a long one, so I'll read part of it, and I would love for you guys to go to iTunes and check out the rest of it. And thank you for everyone that reviews and rates the show. It allows us to continue to be found by people all over the world, and they can learn so much of this goodness. On our show today, we have Machell, who was co-hosted but with Machell. It was Machell's shows, and they interviewed Anne Rice. That should be a fairly familiar name for you. She's all over social media. She's all over speaking. If you would like her to be at your study club or even speaking at your annual session, she would be a great speaker for that. So without further ado, here is Machell, and Anne.
Hey, Machell.
Yeah?
It's time for the interview.
Oh, but I had something else to say.
We need to let the experts talk now.
Fine.
So listeners, I am still at the Collaboration Cures, AOSH, AAPMD, all the other acronyms that I can't seem to manage to remember. And this is an incredible time. I've learned so much. And I love when like-minded people are coming together. One of my like-minded friends over here is Miss Machell Hudson.
Good morning.
Yeah, good morning.
I'm so happy that you're here. So the very first time that I met Machell was at AOSH 2017. And I was
How do you remember
crazy
that?
girl because when you were smiling and sweet, but there was like this look like, who in the world is this crazy woman? But I was like already obsessed with A Tale of Two Hygienists, and I saw her from across the room. And it was probably like, you know how when you're like running in a movie, it's like slow motion.
It made my whole day. I promise. The fact that anybody was listening to it back then, I was like, wait, how did you even find us?
Originally, I was like diving into the whole oral systemic.
Mm-hmm.
We already had a great program at work, but we wanted to make it better in our office. And there is no better place to go for oral systemic education than AOSH.
Yeah.
So, but in the process of trying to learn more, I had Googled Beldonine and I love podcast. the interview that you did with Brad Bell and Tom Larkin.
Yeah.
And I loved you and Andrew so much that I got sucked in, and I can't even tell you how many hours that first day that I listened, and I was like, these are my people. I mean, because we're hygienists, and I don't think that a lot lot of people realize just how intelligent we are and how obsessed we are with learning. We want to be better for our patients. And so thank you and Andrew for being so wonderful.
So from podcast fan to podcaster. Because you
How fun is that?
I know, it's amazing.
Thanks for believing in me, putting up with me.
So you are co-hosting Reflection Health podcast on Dental Podcast Network channel one. Okay. I can't keep them straight, but yes. So if you want to hear Machell and Katie talk about health and nutrition and everything that could be under that umbrella, you should definitely check out that podcast.
Yeah, it's really fun and it's smart. Like Katie says, we just dropped some knowledge bombs.
Yep. But we are here for a purpose. We're on a time crunch too. But this seemed like such a great moment. So Miss Ann Rice came over to me yesterday.
Yes,
Welcome
I did.
to the
I was a
podcast.
groupie. I've been like a little groupie fan from the sidelines. So.
And vice versa, because you on Facebook and stuff, you put lots of great things. So I love all of that information.
Yeah.
But tell us about you, who you are, and like, what is your mission right now?
It's a soul mission, and I kind of fell into it. It is really, the quick version is utilizing us in the dental world as we already know, valuable healthcare providers that Machell alluded to before, but to change the trajectory of the disease of Alzheimer's and dementia. And what's really crazy, when I started to research dementia because of some family things with me, and I started looking at, we don't have a drug, we don't have any solution to this disease. And so as with every systemic disease, it's prevention. And when I looked at these modifiable risk factors to prevent the disease, it was stuff that I was doing in my practice. It was from blood pressure to diet, nutrition, for sleep, lots of different avenues. And what really hit home was bacteria, yeast, and the herpes virus are really kind of flamethrowers to start this disease. It's a neat process that goes rogue. So those three things, bacteria, yeast, and the herpes virus, we are knee deep in every day, every patient, every hour. And if we could just use our normal assessment protocols we're already doing, I'm not asking a hygienist, we're already in such a time problem in dentistry. You know, our hour is getting shorter, and I'm not asking anyone to do anything more than what they're doing. Just tweak a little bit and be a little more educated. And if that conversation can come up with your patients, to fill them with a little bit of knowledge. And also for our personal lives, there's a lot of things that I talk about. I talk about dementia and dentistry is primarily one of my talks, but everything that I talk about is something that you're going to use today when you go home and tell your kids and your sisters and your parents different strategies to help try to drive down this disease.
And so when did you start in dentistry?
Over 30 years ago. Yeah, I was a dental assistant in high school. It was, I've never told this story out loud. This is crazy. So I got this job filing charts. So go way back when there was a paper chart,
Which
right?
is not so far back for some offices.
Well, that's true. Then the pegboard system for all of you old timers, when that's the way we did finance. But it was handed down from pom-pom girl to pom-pom girl in my little city. And so there was an after school job. And so I worked in this dental office, and then I went to college, was majoring in business finance, and that was not my scene. And then I went to hygiene school, and I graduated in 1989. So it was a long time ago, and I've done it ever since. The longest time I've really taken off was 4 months after I had my son. So I've worked full-time or part-time ever since.
All right. So what does this actually mean to us? Like we're knee deep, like you said, in viruses, bacteria, and herpes.
Right. Yeah.
Or herpes and viruses and fungi.
All the good stuff, right?
The good stuff.
So with those three things, we have this very cool innate immune system in our brain. They call it a glymphatic system. And that was coined it was just in 2012.
I was going to say that was pretty recent.
Yeah, it was Macon Nedegard, and she was out of Rochester. And, we have the lymphatic system for the rest of our body. We know about our lymph nodes that we palpate during, oral cancer screenings. The brain has this glymphatic system, and it's focused on microglia cells, also astrocytes. So we get this insult in our brain. We get some inflammation, something, and we get these amyloid beta plaques that grab onto those insults. Well, unfortunately, they can't be cleared when you get too many, and they aggregate, form these clumps. This is what the amyloid beta plaques are. It's like little meatball-like structures. And so you're basically choking off your synapses. So your communication to get from one thing to another during your memory. So there's that part. And then there's something called tau tangles, which is inside of a nerve cell. So what we know about these insults, and I say that it's a hypothesis because in science, as we all know, we are learning in AOSH about really scrutinizing our studies. Yes. That this hypothesis that these bacteria, yeast, and the herpes virus really start a lot of these plaques from laying down. They're all different. There's lots of pathogens that are related, are high risk periodontal pathogens related to the brain. Some of those, this is for a 3-hour discussion, but I'm going to hit the highlights. We all saw this Porphyromonas gingivalis study that came out in January that everybody put in the press as being a really big component of that, something everyone needs to consider. That was a very small study. It was done on mice. It was funded by a drug company. So it was great. It is really leading. Actually, this company is looking at this for periodontal disease, which is really amazing. We're going to get somebody on our team that we're not having to pay for them to be on our team, which is lovely. But what they did is they swabbed these mice with PG. They immediately started making amyloid beta plaques, and they had neural decline, cognitive decline. And so that's how all this started. That PG actually releases something. It's an enzyme called a gingipane. And what they're trying to stop is that gingipane from getting in and doing damage, because that's where that problem is. You look at other pathogens, and Machell, you totally know pathogen. That's what you talk about all the time. Another high-risk pathogen is FN. And FN is a little bit different, and that really disrupts blood vessels. It causes little tiny holes in those blood vessels, and not enough that you're going to bleed out, of course, but that bacteria gets into your bloodstream, and it also gets into your brain. You have this blood-brain barrier that I don't know. I was under the impression it's this concrete wall. Nothing can get into the brain. No, so not true. As we age, it becomes more permeable, poor sleep. A multitude of things makes that barrier less effective. And so we find that, vessel health is so crucial to brain health. Spirochetes, which, Machell, you can totally get into how difficult it is to deal with those little suckers that burrow themselves inside. That is a big one involved with Alzheimer's disease. Years ago, Dr. Judith McCloskey did a study. She autopsied Alzheimer's patients' brains, and it was treponemia denticola, which is a little bit different than your Lyme disease spirochete. Lyme disease spirochete is bigger. Spirochete's a spirochete, though. So
I heard a really good, it might have been at an AOSH meeting, but someone said, there are multiple spirochete infections. And was it like Lyme disease, syphilis?
Syphilis, yeah.
Perio. Is there another one? Or is there a fourth one? Or maybe those are the top three. But their point was like, what is the side effect on syphilis and Lyme disease, and is brain fog?
Well, and in years and years ago, they put syphilis patients in mental institutions. They didn't know what was wrong with them, and they lost their mind. And so they were gone into, back in the day, they're called insane asylum. They also have this, some people are saying that Hitler had syphilis, and they contribute some of that. Yeah, right. No excuse at all. But, that was the rumor mill way back then. So a lot of those pathogens, and I have to clarify that the herpes virus. So if you get cold sores, that anyone out there, that does not mean you're going to get Alzheimer's disease. Let's make that crystal clear. But the activity of that herpes virus has got to be stopped as often as possible. And we suggest to our patients a lot of times more on a cosmetic line. So we have lasers and we can stop that lesion, because of what it looks like, or we'll put you on a cyclovir oral medication. And I think that we really focus on the look of that, not what that is really doing to the inside. And we need to,
and the pain maybe, but
right. And the pain, exactly.
Yeah, the cosmetic or the stigma that comes along.
Right. And that is so not, if you have on a health history and somebody writes cold sores, you have the conversation right out of the gate. You either write a prescription, you tell them that you offer laser, if that's something that you offer in your practice. And then there is a new drug called Citivig that you could put a little patch above either 6 or 11. And it's a cyclovir that's put through your system that way. Those results are amazing. Unfortunately, they haven't studied it in a senior population as of yet. And it has to go on just like within seconds, basically. So
and is that or Forward Science that has that one?
No, they're not doing that anymore.
Oh, okay.
But they did up until about probably a month ago or 2 months ago.
To the party, huh?
But that was really marketed through dermatology, which is crazy. Why are they not marketing through us? We're the ones that see that all the time.
And is that for just oral lesions or perioral lesions as well?
You know what? I am not sure.
I know. I want to find that out.
Yeah. I would have to look at that.
Does that work? Or
yeah.
How do you hold everything in your brain, Machell? Like, how does it not
I've been listening to you guys and like in awe of all the knowledge that you have.
But I've got like one thing and I've studied it like nonstop for 2 years. So you've got at least a wide variety in there.
So much information. Well, but I do love when our listeners are like, remember when they said that on that podcast? I'm like,
no, not so much.
So
no.
Especially if that was like number 4 out of.
Right. Thanks for listening. Come back next week.
But teach me again what they were saying.
Right.
So we should quiz you.
God, please don't. Somebody asked me the other day, like, tell me about this person. I was like, were they on the podcast? I'm like,
oh, great.
And they're like, oh no. And I was like, oh, thank God. So I was like, I definitely didn't remember interviewing them.
That's funny.
Okay. Sorry to digress.
No, that's fine. The other thing I wanted to talk about was the yeast. And this Candida study came out a year ago. It was literally a year ago, October 2018. And that yeast does cross this blood-brain barrier. And that's something that we really, we have pathogen testing that we can do for our high-risk periodontal pathogens, but included in these companies, they're also checking for that. And I think that I see a lackadaisical approach sometimes to yeast with a lot of practices. Now, I temp, so I see everything, all good things and not so. Really, if there is any suspicion of yeast, it's really a conversation to have. That is, and for my son, actually, he had issues with it. And of course, with gut health, and we can go into the whole probiotics and all of that kind of thing. But yeast really needs to be driven out, especially your seniors there with dentures and partials. And we see those dentures every single day. That really needs to be addressed.
Going back to our pathology and doing our oral exam, like, are we looking just for like red and then white is when it gets really...
Well, that's when you, complete that of obviously the white, but there's a lot of, and I have it in my presentation, I could look it up, but there's a lot of weird symptoms. You can get some of the burning tongue. Burning tongue is on everything. Do you realize? When I started researching burning tongue, there isn't an ailment that is not associated with that.
That's so interesting.
Yeah.
We were talking about that with vitamin D because I have burning tongue all the time.
Right. Well, and that could be a multitude. That's really a tough one. That burning tongue is associated with diabetics too.
Interesting.
Yeah. I realize for everybody that's listening, there's only so many minutes, man.
I know.
in this hour that you have in your treatment planning, and then you're explaining about perio and all that. This isn't something that it's a dripping of information. If somebody wants this information, they may not. This is something that, and I don't really put this in a lot of my presentations, but we need to consider if you have a patient that has a loved one that has cognitive issues or full Alzheimer's, they have a 60% chance of passing before that loved one and a 600% chance of getting dementia themselves. So if they bring these patients in and you really just be tender and trying to help them understand, they have support groups, but if we can be supportive of this community in any way at all, it's really, really important. It's a struggle, a big struggle.
I just have a quick fast fact.
Yes.
That Angie Stone taught me.
Yeah.
Way back when. If you're starting to see a patient kind of start to decline, right? Like, you see them all the time and now they got confused about their appointment. They couldn't remember what building it was, how that happens. Right. She's like, if they have a denture or a partial, don't put it in for them. Let them put it in themselves. Because if they put it in backwards, that's a real sign of, if they look at it and they flip it around.
Wow.
Oh.
No.
And I was like, that's so weird. That would never hear that. I just don't feel like that would happen. But I'll say the last week that my grandfather was alive, I went and cleaned his mouth and did all the stuff, and I gave him back his denture and he put it in backwards.
Oh my goodness.
And I was like, I could not believe, I actually witnessed it.
Right.
So I just thought that's always been in the back of my head, to not put the denture or the partial in for my patient.
That's great.
But to give it to them,
right,
and make sure, or if they try to put the bottom on the top, or, any of those things where you've had this denture for some of them decades.
It's autopilot.
Yeah.
Right.
They should just put it right in. And it's a sign that maybe we should talk about more issues with cognitive function and lucidity and all that. So,
and I think a lot of senior population are alone. Yeah. And so nobody sees them and sees that deterioration. Mm-hmm. I mean, only the doctors, and some of them can't afford to go to their doctor. We see them a lot.
Yeah, we do. We really do. Sorry to digress there.
But no, that's great.
So when we're looking at that yeast, what could we talk about some of those symptoms or concerns?
And some of the symptoms, and this is what I think is really difficult, and this is where pathogen testing really comes in, because some of these, if it's increased fatigue, really? I mean, how many different
how
things?
do you figure that out?
Yeah, and there's a lot of those, like I said, about the burning tongue, joint issues, and it's the white patches that we have in the mouth. Now, sometimes I know, when you have those youngsters, those young people that happen to drink a lot of beer, and you see a lot, when people think about yeast, you go older, right? You have a lot of young getting out in the world, the opposite of me in my mid-50s, and I go to bed by 9. Some that have a life, right? And we see this on really young people. But I think this is where pathogen testing comes in so important with these patients, with all of our patients. And so obviously, Machell, about all the gum disease and all the different things. PG, which was startling to me, was that PG is found so much now in people under 30 years old, a high level of PG. Yeast is half the world's population. Now, obviously the world's population, and we have issues in underdeveloped countries and such, but that's half of the population with yeast.
At least, I would say at least 90% of my patients that I'm doing pathogen testing on, which is all of my perio patients, and then some of my high risk, even prophy patients, we look at family history as well. And if they have a family history of heart attack, stroke, dementia, Alzheimer's, and yeast that candida is a big problem. And it's what's really cool is having that conversation with them. We know if you're moderate to high in your oral cavity, your gut microbiome is a mess too. You're a mess everywhere.
Right.
So it was really cool. I had a patient and she just could not get better, and she's trying to be healthy. And there's a million, like Uchi said this morning, there's a million diets out there. Mm-hmm. And she was doing one of them. And we just really talked about, sugar and eliminating that, and really just eating. It's so simple. Just eat whole foods. Just eat real food.
I think our gut health in our society is atrocious.
It is
trash,
and it's
pure garbage.
It is.
She went to a whole food diet, and we retested her 3 months later, and she's at 0 in candida.
Okay, that would be tough.
She's this is oral cavity, but it's at 0. I'm at 0. Am I pathogen?
Proud of you, babe.
I'm scared. I've never been pathogen.
Would you like me to
You
test
have not?
Yeah, I'm not. I'm so scared.
I can do it right down. We got it.
Okay. All right. I'm going to film it too. We'll do a little Instagram.
Oh my gosh. Well, you're not
'Cause I'm
going to
gonna
get the
take
results. The
yeah.
privacy of your own home will give you your results.
Okay.
So.
Now,
I'll
you know,
post it there.
Paratus, once that's FDA approved, you'll know in 15 minutes.
Ooh. So if they're yeast and you're talking about diet, I mean, is eliminating sugar just a quick and easy way to do that?
Machell is more nutrition.
But like, what is it? If I'm seeing somebody and I'm like, oh, they're a heavy beer drinker, I'm starting to see some kind of like, just that redness in the oral cavity.
Right.
Can I be like, what are some quick and easy things that I could do for them? Or do they need to be on like a mouthwash or?
The things that I say that in the dental practice when I was like, I look at these things every day, and blood pressure is huge. And I just want to enforce that everybody needs to take blood pressure in their practice.
Say that one more time.
For the people in the back.
Yeah. For you in the back of the room. Can you hear
really
me?
Loud.
Yeah.
Blood pressure is so indicative to so many different health problems.
Mm-hmm.
There are scary, scary statistics with blood pressure and Alzheimer's disease. So as I said before, vessel health is important for brain health. We have 400 miles of vessels in our head. So 400 miles. So we need
In your head.
In your brain.
Not your body. In your brain.
Nope. Just up there. And some of those are really, really small, as you can imagine, unless you have a really big head, I guess. I don't know.
You looked at me when you said that.
Have you seen my head? If anybody knows me, I have the biggest head on the planet and the ears
Not
that
true
match.
at all. None of this is true.
Oh, yes, it is. Glad it's a podcast. So with taking blood pressure, so there were studies that, and this was one of the most compelling ones. There's been a million different studies. There was a SPRINT cardiovascular trial. And so they're looking at cardiovascular disease, and then they move that forward to a SPRINT mind trial. So they're really looking at what does blood pressure do to the brain? Okay, obviously constant pounding. It also works against the blood-brain barrier. And then we have vessel health problems. So when the inside of your vessels, plaque in the arteries, plaque in the brain, it goes very much together. But there was a study that just came out, and this just freaks me out. 500 people, and most of the people stayed in the study. They were born the same week in 1946, and they were, blood pressure was obviously taken, and then they did brain health scans at the ages of 39, 43, 53, 60 to 64, and 70 years old. Midlife high blood pressure astronomically increases your risk for Alzheimer's disease.
Wow.
And I'll read this to you because and I don't want to get it wrong. And for women, step back. Women who had high blood pressure in their 40s were 73% more likely to have dementia. That is astounding. And it's midlife blood pressure. Like if you're a senior, so 70 years old, and you get high blood pressure, it is not going to affect you the same. It is midlife high blood pressure. And so many people live with, what do they say? 87 million Americans have high blood pressure.
What?
Or, no, it's 106 million people have high blood pressure in the United States. How many of them are treated? So many of them don't know.
And your patients that say they have white coat syndrome,
Don't get me started.
that is high blood pressure. You have to educate them on that.
Right.
I don't care if their blood pressure is normal at home. It is high in your chair. That means it's high. Every single time they're in a stressful situation, they have high blood pressure.
What a good way to put that, though. Like, if this is a stressful situation for you, then it makes me a little concerned about how your blood pressure reacts in other stressful environments.
Right. I live in Houston.
Mm-hmm.
I mean, it's driving to the practice. Their blood pressure's up all the time. And then they walk in the door and it's high. You know, in Europe, they have this ambulatory guidelines for blood pressure, and you wear a cuff at home for 24 hours. So they take it every 15 to 30 minutes during the day. And then at night, it's every 15 to 30 and then 30 to 60 minutes to get a real good measure of what the blood pressure is.
Baseline of your day.
I would love to do that when they say they have white coat syndrome. And it is like a little bit pregnant. Let's clear this up right now.
I love it when you say that.
So you're not a little bit pregnant, right? You either are or you're not.
Right.
Your blood pressure is 121 of whatever the standards are now, and I'll get into that in a minute. 121 over 81. Guess what you have? Hypertension.
Because
you have high blood pressure, and plenty of physicians are out there.
I know.
They're cool with it.
Ignore.
Oh, we all know the story of my sweet patient that for 3 visits, I begged her to go to her doctor and talk to her doctor about her high blood pressure. She is in her 60s and very healthy, yogi, lifts weight. I mean, she's a beautiful woman. You see her, she glows. She looks 20 years younger than what she is. She had high blood pressure and her doctor said she was fine. She came back to that 4th visit. She rescheduled a couple of months out, which she never does. She had had a stroke.
Oh my God.
I walked out into the waiting room to get her and she stood up and she started crying and she hugged me and she said, I will never not listen to you again, because I begged her to get us. I told her, because her doctor was like, it's okay. You're healthy. It's genetic, whatever. So I begged her to get a second opinion and she did not. And I love her and thank God that she is so healthy. She thought she was healthy, but not healthy because she had a stroke. But because of her lifestyle, she made a full recovery.
I was going to say she could recover faster.
Mm-hmm. There's a lot with some of this Sprint Mind trial. What they found was aggressive treatment to lower blood pressure. So really what you're honestly looking for is 115/75. I mean, then you have this wiggle room. If you have a patient, one of the examples I talk about, things that you need to understand, birth control pills can elevate your blood pressure a little bit, and naproxen, some of Aleve, some of those medications. So if you have a patient that's been golden for blood pressure, and really look at the health history to look at what are the changes, what's going on. I mean, we all have a stressful life. So yes, it may be going up or they put on 10 pounds, but really understanding some of the medications that we take that's increasing blood pressure. I wrote an article that came out a little bit ago about hibiscus tea, and I really want to throw this in there for the people that don't know. So this was an accident that I really understood about hibiscus tea. My niece works at a well-known coffee shop, and so I would go by and visit her on my way to pick up my son. It was late in the afternoon. I don't do caffeine that late. And so she said, well, have this tea by this well-known coffee shop. Mm-hmm. And I never knew what was in it. And as I start to do research about all of this and driving down my risk and getting into this, they talk about hibiscus tea. Well, that is what is in that tea. Mm-hmm. And this is so profound. Of course, it's filled with antioxidants and it's a red color. It's called sour tea. People have been drinking this tea for forever. And in 10 countries, it's the treatment protocol first to lower blood pressure. And there was one study in Nigeria that it worked better than hydrochlorothiazide with no electrolyte imbalance, right? So I'm not saying to throw away your blood pressure. Please, everyone listen. Yeah. Go. Your doctors are great. But if yours is creeping up just a little bit, try it. Try to drink it a couple times a day. You don't have to go to a coffee shop. Mm-hmm. You can buy it now. Most grocery stores are selling the tea bags and you can brew it yourself.
It's delicious and it's actually sweet. I've been drinking it for years. I love it. And another thing that you can do for blood pressure is actually beets are really good. So you can get the beet powder and that's also very good.
I didn't even know. That's great. I didn't know that. Yeah. Sleep is the best thing for blood pressure, number one. And I could get onto a whole conversation.
Yeah. But you could also just go back to our airway series and listen to that because how important and how it affects so many body systems.
It was a 3 or 4 part
series.
It was so good.
Yeah. Julia Worrell. And actually you'll hear her next week on this podcast.
Oh, that's good.
Yeah. So we're going to bookend
She
Julia.
is so smart and always has something. Mm-hmm. There is always something new that I had not heard her say before. And this conference is so good for that. My really mind is going to explode.
But you're right. Sleep is a big component of it. And that's why it's absolutely within our scope to discuss that with a patient.
Oh, absolutely. And, there's a lot of, and I'm going to just, obviously we talk about apnea and you have it in your series, but there's plenty of us that don't have apnea and we have poor sleep.
Yeah.
So really prioritizing sleep. That is, there's a, Greg Potter, PhD, that I just recently did some research on, and they're looking at that 55% increased risk with being short slept for Alzheimer's disease. It really is. Dr. Rudy Tanzi is our one of our best researchers here in the United States. He has a new book that's coming out called SHIELD, and each letter means something. Obviously, it's interacting with others, exercise, diet, learning new things. I'd love to get into cognitive reserve, which is helpful in your brain, but sleep is one of the biggest things. We just really need to take it seriously. For all of us as practitioners and our families, our kids, apnea is as important. That apnea actually triples your risk for Alzheimer's disease. They get it in every which direction. They're never getting into deep sleep.
Right.
And deep sleep, as you probably know, is really the fix for brain health. That's when you clear out those amyloid beta plaques and tau tangles, is during deep sleep. Your brain shrinks about 60%. And that cerebral spinal fluid bays away, cleans out all of those insults and injuries, and gets you ready for the next day. Moves short-term memory to long-term memory. So it is crucial.
So even if you aren't seeing a more geriatric population, like, you really can make a difference in a patient's life in the future for Alzheimer's, dementia.
Oh my gosh, because it's 20 years before that you're putting down the plaques. It's all of us 50-year-olds.
Yeah.
Alzheimer's disease is 60 to 80% of all dementia cases, and that really manifests primarily after 65 years old. So it's what you're doing at 45 and 50 years old that is teeing you up for the disease. So it's all this stuff to pay attention to. I want to mention something about, people ask me this question all the time about, well, I left my keys. Do I have, Alzheimer's disease? Or okay, so no, there's funny stories about that, but there is something called mild cognitive impairment. That's a precursor, 2.5 times more likely with this mild cognitive impairment. And some of the critical factors now that's increasing that is the blood pressure. Mild cognitive impairment, you can see it a little bit with visuospatial issues. It's things that maybe your spouse would say, "You're really? Did you not remember me saying that?" Now, with that being said,
you never listened to me.
Right. Did you not hear me? Well, and some of us ignore. I mean, I get that completely, but mild cognitive impairment is something to really kind of pay attention to. And then that moves forward into dementia, lots of levels of dementia. As we move into Alzheimer's disease, it is not just forgetting where you put your keys. Multitasking is not. That is I don't know where people think that that's the right way that we need to go. You just don't pay attention to where you put your keys, to be quite honest. Yeah. But if you put them in a very weird spot in the refrigerator or behind the television, or you don't know what they're for, clock, not being able to quickly get the time on a clock. There's something called the Machell Cognitive Assessment Test. It's a piece of paper. Everybody should Google that and try to take it and see how you do. And that is what is one of the beginning. We see this in the senior population. They're now starting to give that cognitive assessment in younger populations in really good medical practices, because we really want to know, changing our lifestyle and diet, exercise. Exercise is so important for brain health. It's crucial. That's where we build new neurons, is during this exercise. And there was a study Dr. Tanzi had that came out last year, that something else that happens when we exercise is something called BDNF. If you don't know what that is, brain-derived neurotrophic factor. So that's fertilizer. So you're making these new neurons, right? Well, you got to keep them alive. And that's been the biggest, that's the research that they needed to see. You can build all the neurons in the world if they don't stay alive, right? And during exercise, this is like the protein. This is like the main guy to keep those neurons alive. And that's not, you don't have to be a bodybuilder, man. You don't have to run marathons. This is 40-minute walks. It's really just doing some activity. Yeah. Uchi just said this morning, which is amazing, the sedentary lifestyle that we have and the high population that just we sit. We at our desks and standing is important as well for brain health and being active.
You brought up a good point yesterday, talking about those pathogens going into the nose.
Oh, yeah.
And I have been on this kick because, yes, I'm working with these nose filters, and I just delved into aerosol research and air quality and pollution and the flu and all these transmittable. I'm actually disgusted that we only are required to take our bloodborne pathogens and not the airborne pathogen standard.
Right.
Because I think we are more susceptible to the airborne. Not more susceptible. Let me change that. When the last time we got a stick and somebody got HIV from that, I don't even think there's a case documented.
I don't know. No.
From it. But when's the last time somebody probably got the flu from their patient because they came into the offer? Yes.
Right.
Exactly.
It's happening right now.
Yeah.
It's cold.
Whoever's working today.
Chronic sinus infections, bronchitis, TB is airborne.
Well, do you know that
mumps?
We talked about this yesterday with level 3 mask, and I said level 4, and I call it level 4. It is not. It's maximum filtration. They don't put it as a level 4.
Okay.
You talk about TB and influenza. Level 3s don't block that.
Mm-hmm.
That's into the next level. And I told you that I added nose filters into my presentation after I read some things after you had spoken about it. But let's be serious. All of the stuff that's going in the aerosol, dentists with handpieces, obviously.
Yeah.
And us with Cavitron, we use Cavitron all the time. And these poor hygienists, and I was one of them. Listen, it's like using a piece of tissue paper if you have a level 1 mask.
I know.
You just go ahead and take it off.
Yep.
All of that, and it's in the room, right?
Mm-hmm.
Dr. Tanzi did this, and I told you about this yesterday, in Alzheimer's Summit in 2012. So he's looking at Alzheimer's disease. And so he's talking about periodontal pathogens, how they get in the brain. So we're looking at through the blood-brain barrier, right? We're looking at vessels. We're getting pathogens through the vessels and through the nose. So what do we do every single day? We are just bathing in it.
Yeah.
And we have to take it seriously as clinicians and kind of put our foot down that if your boss isn't going to buy these masks, then just buy them yourself. Really, what's that investment?
Less than $20 for a box of really good masks.
I put them on the list like as soon as I got back because I'm using level 1. I'm sure that's what we have. I am until they come in, but I put that on my list.
Mm-hmm.
And Gay, when she ordered, she's like, Machell, what's this for? And I was like, that's what I need. And
don't
like,
question.
And she was like, okay, high maintenance.
Yeah.
And that's what Dr. Tanzi talks about. He talked about this and think about how much we're in it compared to, he was really talking about what's on our hands and how we touch our face and touch our nose. Okay. That's just what's on your hand. And you don't really, a lot of people touch that, but we have an aerosol that's like going up our nose. And let me be crystal clear. If somebody has a cold sore, please don't treat them for their own sake. My husband, and this wasn't during a dental procedure, I need to clarify that, but he had a cold sore as a child and he has lost vision in one of his eyes. So what you're going to do is you open this sore up. Now you're shoving it up their nose. It could, if you're not using eye protection, there's you're just reinfecting them. And for the patients that have ever gotten HSV1 in their nose, if you think your lip is bad, that's as bad as well. You just don't protect yourself. And as you talk about with nose filters, anything that you can do to keep that bacteria from going.
There was a Facebook post years ago, and we've all had these patients. Like, I get sick every time I come to the dentist. Yeah. I get sick. I always get a sinus infection. And there was somebody that brought that up in a Facebook forum, and everyone lost because this patient, if I remember correctly, was taping gauze across her nose for her dental appointment. And, our community, because we have this group think herd mentality on there where we all go in there to vent and get real frustrated with each other. And they were like, these damn crazy patients, pain in the asses, these PETA patients. Go ahead, say it.
That hurts my feelers when I see that. And I can't, sometimes I'm like, I'm going to delete that Facebook.
Yeah, I know.
Oh, yeah.
And then you can't because then it's like.
Because there's so many positive things. But yes, it's true. But so everyone was like jumping down their throat, and we've always had it. And that's not something that CDC is going to be tracking, right? Like no one's going to, they're going to come back 6 months later and tell us that this is happening.
Right.
So there's no way to really get a stat if we were the ones that inoculated this patient. Now they're getting a cold or the sinus infection or whatever. but we all have it. We all have those patients. And so Anne Guion actually wrote an article about that, how like you should read it because might not be paraphrasing it properly, but pretty much what the point was is that the bugs in the mouth are in there and then you throw them up into their opportunistic pathogens. So they're going to go and create inflammation and infection in the sinus cavity because now it's just this new, warm, wonderful place for me to grow
and it's new
breathe.
And they haven't, well, I think some of them have been in there from the mouth, of course, but let's talk about stirring it up.
Yes.
And how many times has that happened? I can remember I had a patient who had third molars and I just did a regular 11-10 on him and they were tipped just so, and he blew up on one of his thirds. And it's me stirring around everything you stir it up. There's a lot that can happen. And then now you're going to send it up their nose.
Right. Where now we have things telling us that that's where people are going to.
Right. But I think it's important that we protect ourselves.
Mm-hmm.
And I use this example when I'm talking about protecting our hearing, which I'll just drop in that if we have time for a minute. But we have loops that are really for our patients. Let's be honest. So we see better, do better clinical care. Okay, let's backpedal. Let's protect ourselves. We are protecting our patients if we really pay attention to aerosols, obviously, but let's protect ourselves a little bit more. I just love this whole nose filter thing that I did not know about, that was an opportunity. And I think that is an opportunity for so many people. If you're going to stay in this, I've been in this 30 years and we want our hygienists to stay in. It is a great industry. It is something to be positive about. You know, we have ergonomics. Let's do our health too.
Right.
Hearing is another part of this. And I just throw this in really quickly back on the kind of the loop that's better for patient care. Protecting our hearing, the decibels that we're getting from our handpieces and ultrasonic scalars are above the level that we need. With Alzheimer's disease, 35% of the cases as of right now are preventable and 9% is related to poor hearing. When you don't get it in, our brain is considered an organ, but it kind of works like a muscle. It's a really curious part of our body. You don't work it, just like your body, it goes. And that's part of a big, of the senior population. A lot of them can't afford hearing aids, don't wear their hearing aids, they don't work. But with us, why are we not protecting our hearing?
Yeah.
I mean, this is every single day. And they now have devices, that you can hear somebody talk. I can hear you speak. But when we get to a higher level, then it's going to block that out for us.
Can I talk about some pushback and some barriers that maybe people are feeling at the moment?
Sure.
So one of the things that I always get, I'm like, I don't have the time for this conversation, or I don't have how am I supposed to bring this up and talk about, this and cell dentistry and restorative and crowns and implants and all that stuff. And then the other pushback I always get is like, my doctor's never going to buy this for me.
Oh yeah. No, I totally get this. The doctor's never going to buy it. Now the masks, I mean, that's up to you. And that, it is a lot cheaper on a level 1 mask. I'll tell you that. They're very inexpensive. The pushback on time, and in my presentation, we're talking about blood pressure. You're taking it anyway, or you should be taking it. You are not going to do a diatribe about Alzheimer's disease. And let me be 100% clear right now, is that periodontal disease does not cause Alzheimer's disease. There are so many pathophysiological processes with this and etiologies. That's the reason why we've studied it, and we do not have a drug. We do not have a cure for this disease, but it is modifiable risk factors. So for a couple of minutes when you're talking about your puppy or the wedding, just dialing that back just for a couple of minutes, using an example, use me. You know what? I was listening to this podcast and blah, blah, blah. And just a little snippet. We've all learned now about motivational interviewing. It's about listening, creating the environment that you can have this discussion. Listen, there are right now almost 6 million people in the United States that have Alzheimer's disease. If you think that your patients do not have a family member or a loved one involved with this disease, you are wrong. And by 2050, it's going to be about 15 million of us. Baby boomers are now moving forward. So you have patients that have family members. Just having a conversation about sleep, turning it back on yourself. If they can't talk to you, right? So you're talking to them, and you can say, listen, I just found out about sleep, and I heard this. It's dripping that little bit of nugget to the patient. You're not changing your protocols. Pathogen testing is huge. So many practices are not going to do that. But the thing that I start my presentation with and I try to end with is my goal of your value as a healthcare provider. You are not just a picker and flicker. You are not just a dental hygienist. You don't just nothing. You're a valuable healthcare provider that needs to be utilized to help change this disease. And you have no idea. You're saving lives right now. You don't even know. You have no idea.
Amen, sister.
Yeah.
So it's just little bits of information.
Just shoot out, like with my patients, we do a lot of pathogen testing, and that's great. And you can really, because it's a visual, they see it, and I send them home with tons of information. So that's really connecting that oral systemic. If you don't have that opportunity, just talking about statistics and just the connection while you're working, like you said, that not only benefits your patient, but that's also going to help you in those holes that you may have in your schedule. And you're going to see that less and less and less frequently because your patients know just how freaking important that hygiene visit is. So they're going to start, how often I have a no-show? It's rare. And my patients, yes, I do have reschedules. Let's be real. I'd be a liar if I said no, but it doesn't happen that often because they know how important their visit with me is. So when you start talking this, it creates value.
Yeah.
I mean, pathogen testing is going to be slow on the uptake. They have 5 millimeter bleeding pockets. I'm pretty clear that there is some high risk pathogens in there. So let's just move forward with that. Some of the pathogens, I don't have to have them tested. I don't know exactly which ones they are, but I know that they're there, right? They have periodontal disease. So then you just move forward. Listen, some of these pathogens contribute to cardiovascular disease. And just to be, and I clarify this because a lot of people, and I've seen it from your pulpit of your operatory, we are not totally in causal, but there are relationships. Give me a break. We're all attached. It's all one big system.
Exactly.
Another thing about cognitive reserve that I want to throw this in, it's about learning new things. So it's not words with friends in the middle of the night where you're looking at the blue screen and you're not getting any kind of sleep. It's learning new vibrant things. So yoga has been shown because of community. It does great things for your health, learning a new language, learning chess. And I think that when we have televisions in our operatories, if you are not forced to show crown and bridge or root canals and implants, which is disgusting, and I don't know why people show those on a big screen in their operatories, but they do. If you get it away from Kardashian TV and you move it a little bit to not Nova necessarily, but some of those others with the words that your patients can read and get actually quality information, little trivia. My parents go to the doctor all the time, and the screens in their waiting rooms are trivia things. They're knowledge things.
I have always wondered why we don't utilize our waiting area to be information area, like where people can see not that they're selling implants, not that they're selling these things,
right?
But maybe discussing the oral pathogen testing or and throw in some trivia in there.
Right.
I mean, that sounds amazing.
Unfortunately, people are in the waiting room a little too long these days anyway.
Yeah.
So
like utilize it.
But I think, and I will say this, in that would be great to utilize this, but where is everybody's faces when they're in the waiting room?
In their phones.
Stuck in their phones.
It's true.
So,
I give them questionnaires.
Yeah.
They have to fill out questionnaires for me.
Of course you do.
Yeah. Good.
Just
my
saying.
most glorious girl. Yes.
So I also want to know about so that we have an engaged hygienist, like she's just soaking this in, or they're soaking this in.
Okay.
And
great.
they are like, I am on board and I want to have this conversation, but my doctor does not believe in it. The doctor doesn't believe. And someone asked me yesterday, Machell, how do you get somebody that who's a dentist that says they only have like 5% of perio in their practice. And I'm like always a smart ass where I'm like, well, what kind of unicorn practice? Like, tell me where Utopia
where do
is,
you
because
live?
I want to live in Utopia too.
Right.
But if that is that dentist, right, they're more restorative, or they're just not really driven to identify and code things properly. But that hygienist is like, please, I want to talk about pathogens. I want to talk to you about these things. How can they maybe have these conversations? That's not going, I think they should have a conversation with their doctor, but
They should, but sometimes those relationships just really are not there.
yeah.
You have to do what's best for you, and we all can modify and discuss things with our patients. You can have the conversation with the doctor, but ultimately, it is his or her practice. And it's also, you talk to the doctor the same way you talk to your patient. This and this, and I learned this, and da-da-da-da-da. It's a back and forth conversation. I think people would be, and this happened to me some years ago. So I've been in the game for 30 years. There's an ebb and flow with this scene.
Yeah.
I mean, you have highs and you have lows. And when you learn more, I think you have longevity when you learn some of these things. And the doctors, man, they don't have an easy job in any way, shape, or form. They're getting it from every which direction. They're having to learn all of their restorative and their new products and that kind of thing. I think if you want to take more reins and responsibilities in the practice, then there's a trust issue. Then they're looking at you as more of a contemporary and giving them the information. Medical doctors, that's the thing that they get complained about. You think that they have time to learn all this? They're working, some of them 80-hour weeks.
Yeah.
They need dribbles, concise. Here's the information. Here's the documentation. And not just saying, oh, I learned this in a CE.
Mm-hmm.
Bring more to the table than that. Bring some more information.
So I'm a consultant, and believe it or not, most doctors want their hygiene department to be in charge. Most of the time, you get to go to your doctor and say, I want to create this program. And let me tell you, we don't care about the money, but you talk about how much money you're going to produce for them, because guess what? They care about their health. They also care about that office being productive.
Mm-hmm.
And so it's a great way to create this program, because it's going to make your practice more successful. And we win because we get to take better care of our patients.
Yeah, that's a good point. So we have courses to go to, parties to go to. What if somebody wants to find more information or even contact you, maybe go to your course? Where are those?
It's easy. Okay, so I'm going to tell a tiny little bit of a story.
Yeah.
Okay, so my name is, I hope she said it in the beginning, right? Machell, you said my name?
So, but say it
All
again.
right. Well, it's Ann Rice, but if you were to Google Ann Rice, you probably would not find me. You would find an author, and I would be 7,000 million times down the list. So it's Ann with an E-O is the middle initial, Rice. So everything is Ann O. Rice at Gmail. If you wanted to email me, my website is annorice.com. And then I'm on Facebook under the exact same thing.
Yeah.
So,
and go take a course. Do you have like references or resources for people on your website?
I do.
That's awesome.
And the one thing that I like to talk about with the courses is that this is such a complex issue. If you have a question, and I get them a lot, if I don't know the answer, I'm a nerd now. I wasn't a nerd when I was younger, but I'm such a nerd. So I reach out to researchers and scientists, and they are very nice.
Yes.
And they send me answers. And so if there is some weird question or you want, I literally have over 500 studies that I've gone through. I will get the information to you if I don't know. It changes every single day. I am inundated with new research. So every week there's something else that's coming out, and I am more than happy to. This is really important to me. And, when it affects your family, you go through in the beginning of fear, and then you have to move that forward. You have to get past your fear, and you have to make a difference in some way. And my tribe of dentistry, we can make a difference in this. We do it every single day.
Yeah. This has been fascinating. And I would, as always, talk for hours on this podcast with interesting people. So thank you for coming in and sharing your content and your message.
Appreciate this. Thank you.
This is great. Thank you to my co-host, the Machell Squared podcast.
Thanks for having me.
Check out her podcast. Check out your website. And come to a Collaboration Cures meeting too.
Oh, absolutely.
Yeah. Great, guys. Thank you.
Thanks.
Have a great day.
Don't you just feel so much better having listened to that? So much knowledge there. Thank you again to Anne for agreeing to be on the podcast. If you guys wanted to reach out to her again, she's more than happy to speak with you. If you have any sort of study club or any sort of event going on, she would love to speak. I promised an iTunes review that I'd read on the air right after the interview, and here it is. This is from Heidi Dental Mom. 5 stars, love the education. Again, this one's a little bit of a long one, so if you guys want to check out, she has some things that she wants you to check out, so you can go to our iTunes review and find it there. But she says, I love what you're doing here, a very comprehensive, multidisciplined dental education. I am a dental assistant who is married to a dentist who has joined an airway breathing company. And she goes on to say how much she liked Dr. William Hang's episode, and she has some suggestions for other people that you can look up. And it appears that airway, the remodeling of the craniofacial enhancement is up her alley. So if you guys want to check out what she has to say, then please head over to the iTunes review page. Okay, well, that's about it. We are on all of the social medias, Facebook and Instagram. You can email us. I know the email address, andrew@ataleoftwohygienist.com or Machell@ataleoftwohygienist.com. Michelle's doing some really cool chairside chats. She's doing some Instagram lives, I think they're called, and some other really amazing things for the practicing clinician to tune into and learn some real life applicable things, not just theory and opinion. She's doing just amazing things. So make sure you follow all of our social media stuff. Check that out. And if you guys have any questions, just let us know. We look forward to next week's episode. And with the holidays coming up, we hope that you guys are safe and surrounded by those that you want to be surrounded by. Have a good week, everybody.
Bye, y'all.
Bye.